Hi, my name is Melissa Jansen. I'm doing Module 1 assignment regarding the lungs. We watched a video and read information on creating a model of working lungs, just breathe. Went ahead and built a model, and so that's what we are doing. We're going to be showing off our model as well as talking about the lungs. So as far as the body goes, we've got our trachea or our windpipe that goes down into our two separate sets of lungs. We've got our right lobe and our right lung and our left lung, and then we have our diaphragm here, all within our chest cavity. So the first question is, describe the process of inhaling. Pull down on the bottom, and as you can see, the lighting in here is horrible. It is working. I don't know if you can see it. Yeah, right there. Okay, perfect. So when you inhale, you're technically inflating your lungs. You're taking in more air. You are contracting the diaphragm downward, and then the rib muscles pull upward, and oxygen fills the lungs with air. And to describe what happens through exhaling, we're deflating our lungs, pushing out the air, and then our lungs get smaller. Also during exhalation, the diaphragm relaxes, and then the lungs contract, which causes air to be pushed out, and it decreases the volume of the thoracic cavity, which would be this area here. The next question is, why do some people have a larger or smaller lung capacity than others? And I believe that all occurs based on the body size and type of the person. Fun fact from the American Lung Association is that the maximum amount of air that your lungs can hold is about 6 liters. So that's 3 large soda bottles full of air. Your lungs mature when you hit around 20 to 25 years old, and about after 35, they start to decrease in function. When you have a large thoracic cavity, you're honestly going to have a larger set of lungs, and if you're small, little, and petite, your lungs are going to actually match that as well. Describe how asthma affects the lungs. Asthma is a medical condition that does affect the lungs, and it causes your airways to narrow and swell, which produces extra mucus, making it hard to breathe. And it can cause wheezing, coughing, whistling, shortness of breath, tachycardia, all kinds of other issues that come along with the asthma. Unfortunately, I have 2 of 5 children that have asthma, and it is pretty rough to deal with. So it affects the lungs by causing excess mucus, and it lines the lungs, which can eventually be bothersome, and then it can turn into pneumonia from there. And with priorities, medical, including medications and nursing management for an asthma exacerbation, what you're going to want to do is, obviously, we're going to pull our ABCs, airway, breathing, circulation. So if a patient shows up to the emergency room with shortness of breath, tightness, pain, wheezing, any of that, then we are going to go ahead and most likely induce medications that open the airway, such as albuterol. I believe adrenaline also is one of the medications that can be given. We can also give Benadryl if it's an allergy-induced asthma. And from there, we're going to also do breathing treatments, albuterol breathing treatments. There's other breathing treatments that can be done. We'll probably place the patient on oxygen so that we can ensure that they're getting enough O2 in their blood cells. There's actually quite a few things that we can do in order to treat an asthma exacerbation. And what would be important to teach the patient with asthma? First and foremost, always avoid anything that you're allergic to. If you're allergic to shellfish, don't eat anything with shellfish. Eggs, it's all the same. If you have allergies, or excuse me, asthma, and you require an inhaler, please take your inhaler with you at all places. You can even get a medical ID bracelet that says you have asthma. That way, if something were to happen to you, while you're out, somebody could verify that, in fact, you were having an asthma attack. And there are different community resources out there within the community. We have our physicians and other healthcare providers, school nurses, local health departments, the emergency rooms, urgent cares. There's also an asthma community network.